Yes, we are live now.
Good evening, everyone. On the 19th episode of Tuesday Tea Time with Dr. Kawita Bapat, ma'am. And before starting the session, I request everyone to keep on mute mode and videos on close mode for the better recording. Now, I welcome Dr. Kawita Bapat, madam, my mentor and candidate for the post of Foxy president, known for her one-day without hysterectomy and developed many innovative ideas to improve the practice of gynecologist with her many academic program and visual learning.
Thank you,
She's a
beta.
person with a golden heart who will be uplifting everyone around. So, ma'am, screen
Thank
is
you,
to
beta.
you to take
Thank
it
you.
further.
Thank you so much, Raja. Thank you so much. Please put the CV of Dr. Jaideep Malhotra, madam. Yeah, thank you so much. So good evening, everyone. Tuesday Tea Time, Learn Simply with Kawita Bapat is a platform of the conversation, insights, and the knowledge sharing. It's a take-work messages, especially this crisp knowledge about the various subjects and through the conversation with the leaders and experts in their respective field. Our goal is to provide practicing OBGYN to assess the valuable information and knowledge that can help them to grow professionally and personally. Today, I'm really very happy. Today, we are having our own Dr. Jaideep Malhotra, madam, and the topic is Born Too Soon. This is the topic. The Professor Jaideep Malhotra is accomplished and highly recognized individuals in the field of OBGYN, particularly in the reproductive medicine and women health. With an impressive list of qualifications and achievements, she has made a significant contribution in OBGYN with all the awards and for her work. Some notable praises, achievements, and awards which she is having is a managing director of ART Rainbow. Number one. She is a chair of the FIGO REI committee, and that's very, very important thing. That's a reproductive endocrinology and infertility committee. Member of accountability of the group PMN CHWHO, and the Professor Jaideep Malhotra is a member for this PMNCH, and which is affiliated to the WHO. She is a vice president of INSARG, and this is the INSARG is a Indian. This is the vice president Indian Society of the Assisted Reproduction, and the past president of various and a very prestigious all the associations which anyone should know about. That's a Foxy, ISAR, Aspire, IMS, CEPOMS, and ESPAC. I'm really proud that I know such a great person. She is editor-in-chief of CEPHOG and CEPOMS Generals, and she is a regional director of South Asia A.N. Donald School of Ultrasound. She is also the professor at Dubrovnik International University, Croatia, and she is the initiator of various projects and organizations. Number one, the most important projects which she started, that is including the Club 35, which is a Rotary Club Agra Grace, Adbhut Matrutva, which is very, very important. And the most important is a TechnoSavvy, that's a iMums app, which is very, very important, and which she has won the award about the Atmanirbhar app challenges. She has credited a single significant milestones into the IVF in Agra, has credited a significant role all over, and including the first 500 IVF babies even in Nepal, and first IVF ICSI and TISA twins in Uttar Pradesh, India. She is advisor to prestigious medical colleges, and very, very important, especially she is advisor to the Maulana Azad Medical College, New Delhi, JNMC Aligarh, SMC Medical College, Jaipur, and so many national and international organizations. It's very, very important. And the highlighted thing is the exceptional contribution and recognition in the field of medicine, but the notable awards include the FRCOG, FRCPI, and the Lifetime Achievement Award of the ISSRF, Forbes, and the most successful women, DLA Women of the Year, Amar Ujala Gaurav Samman, and the latest one she has just received, few more, that's the Economic Times Most Inspiring Women Award, and many more. And important things, so many contributions into the book, the publication. Why I am talking all this? Because everyone should know that how a person can be accomplished. A DC Datta best book publication, so many things, ERA and all. But the most important thing which I like to talk today, and we are going to discuss today also, that she has been designed and floated that app, iMums, a pregnancy companion, and this app addresses the pregnancy care, parenting, and based on the theory of the first 1,000 days of the baby. So very, very important. And for that, she got the Atmanirbhar Award also. But today's topic and the dialogue today, which we are going to talk today, is basically as she is working with the PMNCH, and she has coordinated with many more things. Born Too Soon is a very important topic, and she's doing very hard work into it. So first, welcome, Madam Jaideep, Madam, to this VIGA in the Tuesday tea time. I like to have some opening remarks, and then we can talk something, a few questions, which will be very crisp, and we can finish it in 20 minutes. So, few opening remarks about the topic that's a born too soon. It's a timeline progress, what it is, please. Thank you so much. Over to you.
Thank you, Kawita. Thank you so much for, such a generous introduction. I don't think it's really required because we are all karma yogis, we just want to do whatever can be done. And that's something which is very, very important to all of us. This is something which, a topic which when you were asking, I wanted to talk about was because as you are aware that I am the member of the accountability group of the PMNCH, which is Partnership in Maternal, Newborn and Child Health. India is a very big partner and a role player in PMNCH, though it is a part of WHO. But we must understand why. Because firstly, yes, India is a big country, most populous country, and plus India has been working a lot on the mother and the child and newborn health for a long, long time now. For at least the last 2-3 decades, we have seen immense improvement in our data, which is going to the world now, whether it's maternal, neonatal, or infant mortality. But the question which today we are going to address is, I'm just going to give you one example. China and India have the same population. But in India, we have 3 times more preterm births than China. Today, when we talk about numbers, we have the maximum number of preterm births which are there are in our country. And our region is the maximum, I would say, contributor to preterm birth. Now, what is important today to understand? Preterm birth. Preterm birth is not only that we'll not be able to save these babies or their mortality is going to be much higher. We are going to lose many more of them. But those who survive also are going to have a lot of handicaps. Yes. And these handicaps are not limited to younger age, which we normally think about. Even in the later age, like if you know, I don't know how many people actually understand that preterm births are having more of all these NCDs, non-communicable diseases, cardiovascular
problems,
episodes, stroke, and many other issues. So we need to correlate all these with the preterm birth. And why all these NCDs are rising in our country? What are the major contributors? We cannot reduce them. And then it's like a vicious circle. These NCDs are then contributing to maternal mortality and neonatal. So we need to integrate and understand and then work towards it. And that is one of the major aims for me choosing this topic today.
Amazing. I mean, this topic is born too soon. That's what we actually, it's not a day's thing, which I could read out and find it out the way it should be. But looking back to the future, as there is always the statistics which you talk about. And as you said, because of the India, the bigger population, and still we have a statistic story is also there and contributing much morbidity, not the morbidity more than the mortality. And that's very, very important. So as being a senior OBGYN and a part of this, would you like to take some points, or do you like to highlight a few, what the challenges they did while doing the statistics of these things, and what the individuals face and the families face of the affected, the preterm birth troubles them is what I want to ask is how the country wise or any wise, the challenges which we are facing when we have the preterm baby in a family. You're not audible.
So what is important?
Yeah.
What is important today is that, yes, we have n number of preterm births, which if I will tell you, it's about 30 lakhs per year.
Yeah.
The absolute numbers. And this report, which I'm talking about, the first report came out in 2012. At that point of time, we used to have about 35 lakhs.
Yes.
So we have come down by, let's say, 5 lakhs. That's not a big number for one decade. Yes. So that means that we need to do much more, because PMNCH accountability group is making people countries accountable. for, these numbers and what they are doing in their countries. Now, it is not something which you can say, okay, I will do this one intervention and the numbers will be taken care of, because it starts with adolescent health, it starts with preterm preconception care, it starts with preventing multiples, it starts with sexual health programs, it starts with optimizing the pre-existing diseases, nutritional status, lifestyle. Lifestyle, one of the major contributors. We are the obesity capital of the world, we are the diabetes capital of the world, so, and all of them are again leading to this. One is this, the other aspect is the infrastructure. Now, and respectful care which we should be giving to, all, because see what happens, there are preterm births happening in every strata, from low to middle to high income. Now, the high income babies will get probably what they can, but the middle and the low income, and we see it, like I'm running 2 hospitals here, I see it every day. So many of these parents are not able to afford the neonatal care units, so, and have no insurance, to cover these up. So this respectful care, or the care which each of these babies deserve, is also not, in spite of the infrastructure and the human resources being there, a big thing. So these are a lot of these thoughts which have to be, sort of kept into place. And then we need to develop strategies, policies, awareness and accessibility, so that we are able to provide what is required for this very, very important. Imagine 10% is the
big number.
Birth rate.
Big number. I can understand the problems because I had also a preterm child. So the counting and accounting for the preterm births, it's really the important, because if we are tracking and accounting, then I'm really happy that this work is being started and doing in a nice way. We need a comprehensive data, we need a collection, we need to analysis to understand the prevalence and what are the trends of the preterm birth. And that the word which you started putting, that the rights and respect, really it's another important point, that the putting people at a center and the response of preterm birth. It's a really, really important, as you put. As we are talking nowadays too much about the respectful maternity care, same with the rights and respect. And you had given a good insight in this topic. So anything which you want to say, you have already talked about, but any other point which you want to add into the rights and the respects about the preterm birth?
Kawita, long time back, even before I took over as the president, I was nowhere in the picture. But one day I had to represent Foxy in one of the conferences, which I didn't even know. I walked into this conference and people asked me, what do you think about quality care and respectful care? And I said, oh, please let me provide care. Then I will think about quality and respect. And when I was driving back home from there, I was thinking how wrong I was. Because if I can provide care, the only problem is about our mindsets, about our perceptions. If I'm providing care, it can jolly well be provided with quality and respect, because it makes a huge difference in people's lives. When you are providing a protocol-based care with all the love and affection, and that is something which has been missing in our organizations, because we are so focused in many other things. And this, if you remember, this was my theme for my year: health, empowerment and respect for women, quality, ethics and dignity for doctors, because these are 2 very important pillars of our care provision, and they should be definitely accounted for.
And definitely, because we have seen the preterm, the families are so much suffered because of not only financially also, and they definitely need even the family, the baby, everyone needs respect and dignity, because it's a preterm baby families, they are having so much. So other important question which comes in the mind when we talk about the born too soon is there any opportunities which we can provide people or the females who are delivered the most of the preterm deliveries which happen, and what are the women's health problem, the maternal health they having. So are we able to stop it in some manner by some organizational efforts, or what opportunities we can give them to manage this type of preterm birth? That's the question.
Now, that's another important aspect which I say we are the most privileged ones, because we come across all age groups of women. and families.
Yes.
So if we utilize the time when, this couple comes to us, or the mother-in-law comes to us, or a young girl comes to us, in educating on an overall scale. Now that's the most easier said than done, because it's not easy. Where is the time to educate everyone? Okay, now in utero, the atmosphere has to be good, the home environment has to be stress-free, the nutrition has to be good, you have to take salmon omega fatty acids to prevent preterm birth. I mean, there are hundreds of things for you to educate. Now, it can be done in small visits and all. So we need to have programs right from preconception care to antenatal care, then adolescent health, and then reproductive health, and then menopause, all across the life of a woman, so that this awareness is very, very important. And that's where iMom's app came into picture, because preconception care, if you optimize all the factors before pregnancy, definitely, and then you understand what nutrition you have to take, what yoga exercises, then the kind of baby bonding, the family atmosphere which is creating stress. 1 in 3 are having domestic violence. So many of these women land up into preterm birth because of that domestic violence and the stress which they're going through. The personality of the children is so. iMom's app was developed with all these thoughts, so that in one we can reach out to people. We have reached out to our doctors. They also understand now how to integrate and what implications of all these can be on women's health and also on future 2 generations. Because malnutrition, personality disorders, all these are now going to go and have a genetic and the epigenetic effect and affect the future generations. So we need to think large. And we also need to think that, yes, we are the custodians of women's health. Now, the next PMNCH program, which, very recently in G20 has been launched, just this week itself, is adolescent health. We have 1.8 billion adolescents in this world. And if we are able to, focus on adolescent health, sexually transmitted diseases, again, a big reason for preterm birth.
Yes.
So, vaginal hygiene, infections, so many of them. Then if you're able to, tell them what are the preventive measures, how you can think of, take measures to prevent yourself from all those infections. And then you can save yourself from so many other implications and complications in later life. Now, sometimes, somewhere we are also responsible as doctors, like, left, right, and center use of ovulation induction agents. Today, more multiple births are happening in non-IVF pregnancies than IVF pregnancies.
Absolutely.
So we have to understand, and multiple births, if you understand, are 100% reason for preterm birth. So we are not doing any favor to the couple if we are producing multiple pregnancies, because half of them are going to land up into preterm birth, and more than half of those preterm births are going to have serious problems and implications. So we are also contributing to all these, which we should be, mindful of, and should take all precautionary measures. Plus our obesity, diabetes, and other factors which are there.
Absolutely, absolutely. That's so important. If some app is there and which can put all the points and the things can be done in a simpler manner, and it can be this can be what they say, to be available to all. That's another important point for everyone. But the important another feature which I always feel about the care for the small and the sick newborns is a very much high return of investment when we talk about born too soon. That's another important, because cognitive development, the milestones, how it will be taken care, who will be responsible for all the potential problems and all, because not putting in it again that word, that mother of a preterm child of 27-weeker, I know for each and every milestone I was so much worried about. So same thing, though I was a person who could reach to anything, but for general public, when we talk about the preterm births and the baby too soon, the care of the babies are very, very important. So anything which you suggest or talk about, that how to these people should get more and more care by the OBGYN.
I think it's such an important aspect, Kavita. I right now today itself I'm dealing with two preterm, issues. One of them was an IVF pregnancy, twins delivered at about 31 weeks. Both the children are in the NICU, and the couple is not as affording. Now, sometimes we need to also be mindful, because if you understand, I have always emphasized on the doctor-patient relationship, not to run after money. Let the money run after you, which is a very important aspect. Now, this couple comes every day in the morning and evening and says, oh, I have to pay for the neonatologist, two neonatologists, morning, evening, grounds, then and NICU care and all those things. Now, something is very important for us, that these are the things which put the patients off.
Yes.
Now, another very important thing is that even during the pregnancy care and all, good antenatal care, prediction of and prevention of preterm birth. If you're looking at, we do so many ultrasounds.
Yes.
And if you look at the cervical length, right from the beginning, we'll be able to, pick up a lot of these patients who are liable to have preterm birth, and then, take some suggestive corrective measures and help them. Even prolongation by even 1 week can have huge positive implications on the outcome of these births. And that's something, again, which we should be definitely order everything, but then we don't interpret the way we should be interpreting these. So those are another three. And the third important thing is nutrition, which is very, very important. And small little supplements, as I said, omega-3 fatty acids, which is there, which we should definitely be looking into, because it does help a lot. And plus nutrition along with this, if we are also are able to define, in case if some corrective circlage has to be done. And today even circlage is not necessary. You have the Arabin pessary. Progesterone is a big, there are enough number of reports on vaginal progesterone, which helps. We have atosiban. So timely use of those, where you are able to prolong, along with neuroprotection given at the right time, is definitely going to bring the best of the outcome which is there in these babies. And I think the onus lies on us to give all this evidence-based care with quality and respect.
Amazing, amazing. I was going to ask, you have already talked about it, but I was going to ask, the decade to change to 2030 and beyond, as we talk about in next 10 years line, or you can say next 7 years line. We look forward for the futures and the outline goals and for the aspiration for the next decade, which you, and as a concluding thing, you already talked about that these are the few cares which are very, very important. Anything which you want to say that
another very important thing which I would say, we all are like single man army. And another very important aspect is that we do not lay enough trust on our support staff. We do not lay enough trust in training our support staff. If we don't have trained staff and more educated people around us, alone we can't do anything. So please build up armies around you who are educated enough, who understand everything, and will help and support and be your brand ambassadors to carry your message all over. Because you will talk 5 minutes, outside the patient talks more than half an hour with your nurses, with your doctors, with your receptionist. All of them have to be educated to take all these measures so that we can provide better care.
Absolutely. So just to conclude this thing, that born too soon is a timeline of progress from past decade to the vision to the next decade. As Dr. Jaideep Malhotra has already, you have suggested all the right points. And the most important, again, the right and respect, the putting the people center in the response, have a good, great team is one of the things. And the power of participation of all of us. And a great healthcare association should embrace the everything. And the most important point, thank you so much for being with me. And the apps like iMoms, these type of things, which will definitely help the OBGYN and a patient, everyone, to put things, and how in next decade, this type of apps will help out in the reducing the maternal morbidity, the fetal morbidity, the maternal neonatal, every morbidity and all. So thank you so much for joining today. I am really happy to have you.
Thank you, Kawita. And I would really like to request all the people who are listening to me, please utilize the app, because it makes our, efforts much lesser, and it gives a lot of education and awareness to the patients. So use the iMoms app as much as possible, so that we are able to reach out to as many people as possible.
Thank you so much.
Thank you so much for having me. Thank you, and all the best to you.
Thank you, sir.